At McLaughlin Chiropractic Center, we use 9 different techniques in our practice to adjust subluxations and help people's spine. The first one is called Gonstead and Palmer package. Basically, it's a hands-on approach that we do. We actually have 3 different types of techniques here. We have hands-on techniques, we have instrument techniques, and we have table-assisted techniques. The first technique I'm going to demonstrate is hands-on technique. This technique is called Gonstead, or what's called Palmer package, and it's a hands-on maneuver. Basically, you'll hear some noise associated with these adjustments. I've got Christy, one of my staff members, I'm going to go ahead and adjust right now, and I'm going to check her thoracic spine first, and then we're going to administer some adjustments in the thoracic spine. The tight areas are the ones I'm going to adjust, and I'm going to adjust her mid-thoracic right now. Basically, what we're going to do is I've already x-rayed Christy, I've examined her, she gets checked periodically, and I'm going to go ahead and adjust this T7, T8 area. And just a little bit of impulse with the hand, and that's as easy as it gets in the thoracic spine. Lumbar spine adjustments in our office are typically started with Gonstead, which is basically named after a gentleman who's developed this technique. It's more what's called a side posture technique, and I'm going to go ahead and adjust Christy's lower back right now using that. Again, you may hear some noise associated with these techniques, but this is a technique we use quite often in our practice. Okay, go ahead and roll the other side. Stretch that. Okay. And that's a Gonstead lower back adjustment. At McLaughlin Chiropractic Center, we use a lot of cervical chair adjustments in adjusting the patient's necks. I'm going to demonstrate this on Christy. It does feel a lot better than it looks. You may hear some noise associated with this. There's not a lot of twisting of the neck. It's a quick impulse, and that's all it is when we move the vertebrae in the neck area. Another neck adjustment we do is called diversified. This is laying down, and again, this is a technique that you may hear some noise associated with this. This is a real common and popular technique in most chiropractic offices. And that's diversified technique. Another way to adjust the mid-back is what's called thoracic anterior adjusting. And I'm going to demonstrate that with Christy's spine as well. Basically, we use the patient's body weight to adjust these vertebrae. Across your... And that's a thoracic anterior adjustment. Flexion distraction is another technique we use in our practice. Some techniques, it's called Cox flexion distraction. We'll employ this type of technique if we're not getting results with the hands-on or manual techniques. And I'm going to demonstrate what a flexion distraction technique would look like in our practice. Basically, what we're doing here is just moving the lower back and pumping the discs at this point, and then we're going to shift the vertebrae as well, and again just try to increase motion in this spine by stretching the spinal column and the associated ligaments around those lower back vertebrae. Some cases we just deflect to one side or just keep it neutral. And that is flexion distraction. We We're certified in extremity adjustments as well in our practice, and we adjust people's ankles, knees, hips, elbows, wrists, shoulders, TMJ at times. I'm going to go ahead and demonstrate just a typical shoulder adjustment that we work with Christy at this point. Lean forward just a little bit. Okay. Some patients don't particularly care for the noise associated with some of the manual techniques. We are certified in activator methods in our practice. Activator is a technique that's very soft, it's gentle, there's no noise associated with it, and some patients opt to use this technique because they find it more comfortable. I'm going to demonstrate what activator looks like on Crystal here. Again, it's a little bit of an instrument that we put on the joint. Just a quick impulse into the joint itself is an activator maneuver. We have 3 techniques in our practice we've talked about, one being manual or hands-on, 2 being assisted with instruments, and the third is a table-assisted approach. The 2 techniques we have that are table-assisted are this flexion distraction, which we've demonstrated, and what's called Thompson drop techniques. And that's a technique where the table actually kind of goes up and down and takes most of the force versus the patient's spine. I'm going to demonstrate that with Crystal's spine here. It's a little bit noisier because you'll hear the table pop up and down. But basically, we get this back and forth. We're going to adjust her left ilium at that point with the table-assisted adjustment. A typical full spine adjustment, I'm going to demonstrate that right now with Crystal. I'm going to adjust her lower back, her mid-back, and her neck. Again, she's been x-rayed, examined. I've checked her in one every week or 2 for chiropractic adjustments, and this is going to be kind of a demonstrated full spine adjustment in our practice. Roll this way toward me. We typically adjust both sacroiliac joints with Crystal's spine. Roll the other side. Good. On your back. Again, the noise is associated with small gas bubbles that were released when we shift the joints. Similar to somebody's knuckle that may pop. Okay, stay right there. Let me adjust her neck laying down. And that's a typical full spine adjustment at McLaughlin Chiropractic Center.